Hello, my name is Pecor, and I'm going to be discussing Chapter 19 of the textbook, Health and Medicine. More specifically, I'm going to be discussing COVID-19. COVID-19 is a type of coronavirus that originated in Wuhan, China in December of 2019. The peak of COVID, however, wasn't until 2020. Around 7 million people died globally from this disease. But why? In this video, I will discuss the sociological impact of COVID. Firstly, how the spread of disease differed among developing versus developed countries, why, and I will also discuss the effectiveness of societal measures put in place such as social distancing, mask wearing, and vaccinations. As COVID swept throughout the world, many countries responded very differently. Since more developed countries had the means to relay information better and the resources to deal with the spread of disease, they had more success in slowing the rate of spread. Brazil is remarked as having one of the least effective reactions to COVID-19. The government in Brazil had delays in testing, a lack of social distancing and mask wearing recommendations, as well as little communication of the information in daily reports, according to Alfredo Filho, a Brazilian professor of political economy and international development. As a result of this, COVID cases in Brazil peaked late, and Brazil became the country with the fifth largest number of deaths. While there is debate for which countries responded the best to COVID, the efforts in the U.S. were certainly effective in slowing the spread of disease. U.S. state and local governments regulated social distancing measures in order to contain the virus. These regulations included banning large social gatherings, closing schools, closing entertainment venues, and imposing a shelter-in-place order. As a result of these regulations, we can observe a decrease in the daily growth rate of COVID. The growth rate was reduced by 5.4 percentage points after 1 to 5 days, 6.8 percentage points after 6 to 10 days, 8.2 percentage points after 11 to 15 days, and 9.1 percentage points after 16 to 20 days. Without any of the 4 social distancing regulations, the spread of COVID in the U.S. would have been 35 times greater, according to Charles Kortmann in 2020. Conflict perspective can help explain the role of commodification throughout the pandemic. The economy arguably suffered during the pandemic, but many industries thrived and found profit through the commodity of vital resources. Healthcare is expensive, as well as purchasing masks, testing kits, and medicines. During the pandemic, the disparity between dominant and subordinate groups grew larger. This can also help explain the differences between the spread of disease in different countries with varying wealth. But how else does societal pressures impact the spread of disease? Through vaccinations. Many people in the United States didn't think twice about receiving the vaccine once it was available. However, other people wouldn't give a second thought to putting potentially harmful chemicals into their bodies. For many, this is a political reason, and for others, this is a religious reason. Other people simply don't want to put anything other than naturally occurring substances into their bodies. One's culture certainly plays a role in their decision to get vaccinated. No matter their reason for not wanting to become vaccinated, this societal norm for them has an impact on the rate of spread and the number of hospitalizations and deaths. According to a study done by Sehed Makades, a computational epidemiology and vaccine science professor at York University, over a course of 300 days, vaccination reduced ICU hospitalizations, non-ICU hospitalizations, and deaths by 63.5%, a very substantial number. Although getting vaccinated doesn't guarantee immunity, it does reduce the risk of transmission and reduce the risk of death if transmission occurs. The rate of vaccination is ultimately determined by society and their willingness to become immunized. There is no right or wrong decision to get vaccinated, however, altruistic and egotistic ideals may play a part in the decision. The spread of disease was therefore not inevitable. Societal responses and regulations significantly reduced the daily growth rate of COVID-19. As quoted in the textbook, medical sociology is a systematic study of how humans manage issues of health and illness, disease and disorders, and healthcare for both the sick and the healthy. Health and medicine is often regarded in terms of physical science for the body and how pathogens and other things work. However, in terms of the spread of disease, society plays a large role. A public service announcement. COVID-19 now seems like something of the past. Cases have reduced substantially and social distancing has just about come to a halt. However, COVID will have a lasting impact on society. It's important to seek psychological help if needed through the use of therapists and psychiatrists. However, we must not forget the great loss of life we experienced throughout this pandemic, and it's important to uphold some of these measures used to stop the spread of COVID in order to stop the spread of other contagious diseases. Hand washing and social distancing are still important in order to reduce the risk of spreading any diseases to those who are immunocompromised. One of the most important takeaways from the pandemic of 2020 is that you have an impact and you can reduce the spread of disease. Do your part and save lives. Thank you.